Hi class, this is Dr. Shahada and I wanted to briefly go over Chapter 5 on public health institutions and systems. So in this PowerPoint presentation, it really begins with the introduction touching on some questions on the topic of public health institutions and systems. And then there's a couple of scenarios that are presented to kind of get you thinking regarding what the standards are or what agencies get involved. And of course, in this chapter, these questions are answered. So what I'm going to do now is I'm actually going to jump to slide 10. Now, public health is often, so when we think of public health, we usually think of the work of governmental agencies. Now, the role of government is really not the only portion of what public health means, but it's a very important component. So it's important that we often define the roles of other components in terms of how they relate to the work of governmental public health agencies. And in many cases, we usually refer to them as non-governmental public health. Now, in 1994, the United States Public Health Service presented the Public Health in America statement, and this really provided the framework of what continues to define the goals and services of governmental public health agencies. So as listed in your textbook, these include to prevent epidemics and the spread of disease, to protect against environmental hazards, to prevent injuries, to promote and encourage healthy behaviors, to respond to disasters, and assist communities in recovery, to ensure the quality and accessibility of health services. Now, these goals are pretty complicated and very ambitious to achieve. So it's very important to further define the role of governmental agencies. And we will be basing their roles on 3 core public health functions that governmental public health agencies need to perform. And these were stated, and they were built on what was presented in the Public Health in America statement by a report that was published in 1988 by the Institute of Medicine. And what these core functions are assessment, policy development, and assurance. Now, assessment includes obtaining data that defines the health of the overall population and specific groups within the population. This includes defining the nature of new and persisting health problems. We also have policy development, which includes developing evidence-based recommendations and other analyses of options, such as health policy analysis to guide implementation, and including efforts to educate and mobilize community partnerships. Now, the third core function, which is assurance, includes governmental public health's oversight responsibility for ensuring that key components of an effective health system are in place, even though the implementation will often be performed by others. So those are the 3 primary core functions that really frame public health, and we will be basing the roles of governmental agencies by looking at these 3 core functions. First, I really want to define what health is again and touch on what public health is, and then we will continue on the public health core functions. But before I go to the next slide, I really want you, I want you to know that each core function is linked to essential services that a public health department should be providing at the state or local level. So under the core function, say of assessment, right, we have surveillance and disease investigations. Then we have under policy development, we have education, partnership mobilization, as well as policies. And there we go, developing policies. And then under assurance, there's enforcement of public health laws, linkage of citizens to needed care, developing the public health workforce, and evaluation. And at the heart of the core functions and the essential services are the two keys without which public health cannot function. So the two primary components that public health can't function without. And they are system management, as you can see right there, and research. Now, starting on slide 19 on, if I'm not mistaken, I'm pretty sure it's slide 19, you'll see a table that provides an overview of the essential public health services, the meanings of each one, and an example of each one. All right, so let's go to slide 11. All right, so if we look at the definition of health, we see that it encompasses a broad range of conditions. And we've already touched on the definition of health. So, you're already aware that it encompasses a broad range of conditions. It requires physical, mental, spiritual, and social well-being. So ensuring conditions so that people can be healthy is the job of public health. And in order to ensure physical, mental, spiritual, and social well-being, public health requires that society work together collectively in order to be able to achieve such a goal. Now, the vision and mission of public health in America, and that's what is shown on this slide. The Public Health in America statement shown here was developed in 1994 by the Public Health Steering Committee, composed of representatives from public health agencies and key national public health organizations. Now, it expanded on the discussion of core functions that were outlined in the 1988 Institute of Medicine, The Future of Public Health. Now, if you remember before, I had mentioned how we had this statement by the Public Health in America statement that was really built upon the 1988 report by the Institute of Medicine titled The Future of Public Health. Now going back to the Public Health Steering Committee, this committee was actually composed of representatives from public health agencies and key national public health organizations. It expanded on the discussion of the core functions, again outlined in the 1988 Institute of Medicine report. The future of public health. It provides a vision and mission for public health, as well as the context of what public health should be prepared to do and how public health service is delivered. And as you can tell, the vision for public health is pretty broad. Now going to the next slide, the Public Health in America statement also includes a section that defines the purpose of public health, which includes preventing epidemics and the spread of disease, which I listed earlier, but I'll go through them. I'm going to list them again. Protects against environmental hazards, prevents injuries, promotes and encourages healthy behaviors, responds to disasters, and assists communities in recovery, assures the quality of accessibility of health services. Now, in recent years, there's been a series of different public health threats which emphasize the context of public health in the U.S. These events required responses from more than one geographic area and more than one agency. Now, an example with Hurricane Sandy in 2012, which hit New Jersey and New York, it hit in October 2012. It was the largest Atlantic hurricane on record, approximately $71 billion in damages, and it affected 24 states, but the most severe damage was in New Jersey and New York, with seawater flooding streets, tunnels, and subways. Then we had the salmonella contamination of peanut butter in 2011. The U.S. Food and Drug Administration, the CDC, and state and local public health officials investigated a multi-state outbreak of salmonella infections linked to peanut butter. Of special concern because many children eat peanut butter. The collaborative work identified the origin and shut it down quickly. Then we have the H1N1 epidemic from 2009. Now, the H1N1 flu virus caused a worldwide pandemic in 2009 as a new strain of the swine flu originated. It caused about 17,000 deaths by the start of 2010. You all probably remember Hurricane Katrina from 2005. It was the second strongest hurricane on record and covered most of the Gulf of Mexico. The most deaths occurred in New Orleans, Louisiana, and Mississippi, which flooded as the levee systems failed in those areas. And one of the last recent health events in the U.S. is one that I'm sure you all remember. It's a very horrific one. And it's when 19 terrorists associated with Al-Qaeda launched 4 coordinated attacks on the U.S. It's September 11 attacks that occurred in 2001. Now, they hijacked 4 planes, 2 crashed into the World Trade Center in New York, and 1 into the Pentagon. The 4th plane had crashed in a field in Pennsylvania after passengers tried to overcome the hijackers. And in this event, more than 3,000 people were killed during these attacks. I'm sure many of you remember what you were doing when this attack occurred. I know that I did. And it's so many years after, and I still can't believe it occurred. But anyway, back to what we're covering here. So these events required responses from more than one geographical area and more than one agency, increasing collaboration and cooperation. Now, in the next slide, we're covering the top 10 causes of death in the U.S. Now we have heart disease, then cancer, chronic lower respiratory disease, stroke, accidents, Alzheimer's, diabetes, influenza and pneumonia, kidney disease, and intentional injuries, self-harm, suicide, which is very new in the top 10. Many of these causes of death actually can be prevented by public health services and programs. Now, in the next slide, I'm just really touching on the difference between medicine and public health. So public health touches every individual every day, right? Saving millions of lives at a time. When we're addressing medicine, we are looking at it being, illnesses being treated on an individual level rather than on a community level like public health. And when we're talking about population-based public health, it really means that strategy is needed in order to effectively implement different public health initiatives to better the health of the community. Now, in the next slide, we're looking at some of the great U.S. public health achievements. Now, one of the top achievements is our current life expectancy here in the U.S. So the current life expectancy since 2013 is 78.94. And this increase in life expectancy is really due to these different achievements. We have vaccinations. There are now 50,000 fewer cases of smallpox than occurred in 1900. We have 900,000 fewer cases of measles than occurred in 1941. 21,000 fewer cases of polio than occurred in 1951. So programs of population-wide vaccinations resulted in the eradication of smallpox, elimination of polio in the Americas, and the control of measles, rubella, tetanus, and diphtheria in the U.S. and other parts of the world. We also have safer workplaces. When we're talking about motor vehicle safety, since 1925, the annual death rate from motor vehicle travel has actually decreased 90%. Seat belts saved approximately 85,000 lives. Child safety seats reduced risk of infant death by about 69%. And community awareness and driving while intoxicated regulations have helped reduce alcohol-related deaths by about 32%. Now, the control of infectious diseases. So infections such as typhoid and cholera, major causes of illnesses and death in the early 20th century, have been reduced dramatically by improved sanitation. Also, the discovery of antimicrobial therapy has been critical to successful public health efforts to control infections such as tuberculosis and sexually transmitted diseases. There's also been a decline in deaths from coronary heart disease and stroke. Deaths from coronary heart disease and stroke have declined due to risk factor modification. This includes smoking cessation and blood pressure control. Since 1972, death rates for coronary heart disease has decreased by 51%. Also, the recognition of tobacco use as a health hazard in 1964 has resulted in reduced use and reduced exposure to secondhand tobacco smoke. And then we have healthier mothers and babies, which are a result of better hygiene and nutrition, antibiotics, access to health care, technology in maternal and neonatal medicine, and immunizations. So since 1900, infant mortality has decreased more than 90%, and maternal mortality has decreased by about 99%. Now, in the next slide, we are briefly touching on the foundation for public health, which lies within the three core functions which I mentioned earlier, and they were defined by the Institute of Medicine. Again, assessment, policy development, and assurance. And remember, the Public Health Steering Committee further developed these core functions in 1994, turning them into the 10 essential public health services, which have been applied to every facet of public health. This includes national, state, local, and tribes and territories. Now, in the next slide is the same diagram as I briefly went over earlier in this presentation, which it's really just covering again the three main core functions. Remember, assessment, we're talking about monitoring health status to identify community health problems, diagnosing and investigating health problems and health hazards in the community. When we're looking at policy development, really quick, it's informing, educating, and empowering people about health issues, mobilizing community partnerships to identify and solve health problems, and also developing policies and plans. And last, assurance is really when we're enforcing laws and regulations that protect health and ensure safety. Assurance also links people to needed personal health services and assure the provision of health care when otherwise unavailable. Assurance also includes evaluating effectiveness, accessibility, and quality of personal and population-based health services. All right, so in the rest of the slides in this PowerPoint presentation, it's going to include, as you see in the following one, the essential service, which we briefly touched on, the meaning of it in a more detailed manner, and the example. And then after that, I briefly include some information on different public health agencies. Take your time going through it. If you have any questions, be sure to let me know and make sure to read this chapter. Take care, everyone. Bye.